Hello everyone, welcome back to Speak Healthy. Today, we are going to talk about the various signs, symptoms and treatment options for those suffering with low testosterone levels. Testosterone is a hormone that plays a vital role in male development and overall health. It helps regulate sex drive, muscle mass, bone density, and the production of red blood cells. However, as men age, their testosterone levels may naturally decrease, leading to a range of symptoms and health issues. Low testosterone, also known as hypogonadism, can impact a man's physical and emotional well-being. In this context, understanding the signs, symptoms, and treatment options for low testosterone is crucial for maintaining good health and quality of life. In this video, we will explore the signs and symptoms of low testosterone and the various treatment options available to manage this condition. Low testosterone, also known as hypogonadism, can lead to a range of symptoms. Here are some of the most common signs and symptoms. Number 1. Decreased sex drive. One of the most common signs of low testosterone in men is a decreased sex drive or libido. Testosterone is the primary male sex hormone, and it plays a crucial role in maintaining a healthy sexual function. When testosterone levels drop, it can lead to a reduction in sexual desire, which can be frustrating and can impact one's personal relationships. There are several reasons why low testosterone can cause a decreased sex drive. Testosterone affects the brain's hypothalamus and pituitary gland, which control the production of sex hormones. As a result, a decrease in testosterone can reduce the production of other hormones that regulate sexual function, such as luteinizing hormone, LH, and follicle-stimulating hormone, FSH. Additionally, low testosterone can lead to decreased blood flow to the penis, making it more difficult to achieve or maintain an erection. It's important to note that a decreased sex drive is not always caused by low testosterone. Other factors, such as stress, depression, and relationship issues, can also play a role. Number 2. Erectile dysfunction. Another common symptom of low testosterone in men is erectile dysfunction, ED. Erectile dysfunction is the inability to achieve or maintain an erection firm enough for sexual intercourse. Testosterone plays a crucial role in the sexual function of men, and a decrease in testosterone levels can lead to a reduction in the frequency, rigidity, and duration of erections. Testosterone is necessary for the production of nitric oxide, a chemical that helps relax the blood vessels in the penis, allowing for increased blood flow and resulting in an erection. A decrease in testosterone levels can lead to decreased nitric oxide production, making it more difficult to achieve or maintain an erection. Number 3. Fatigue. Fatigue is a common symptom of low testosterone in men. Testosterone helps regulate energy levels and plays an essential role in the production of red blood cells, which carry oxygen throughout the body. A decrease in testosterone levels can lead to a reduction in energy levels and increased feelings of fatigue. Low testosterone levels can also contribute to sleep disturbances, such as insomnia or sleep apnea, which can further contribute to feelings of fatigue. Additionally, low testosterone levels may lead to decreased muscle mass and strength, making it more difficult to perform physical activities, which can also contribute to feelings of fatigue. Number 4. Loss of muscle. Massachusetts. Testosterone plays a crucial role in the growth and maintenance of muscle mass and strength in men. As men age, their testosterone levels naturally decrease, which can lead to a loss of muscle mass, also known as muscle wasting or muscle atrophy. This can make it more difficult to perform physical activities and lead to a decrease in overall quality of life. Testosterone stimulates protein synthesis in the body, which is essential for building and repairing muscles. A decrease in testosterone levels can lead to a decrease in protein synthesis, which can contribute to muscle wasting. Additionally, low testosterone levels can also lead to decreased bone density, making bones more fragile and susceptible to fractures. Number 5. Increased body fat. Low testosterone levels in men can also contribute to an increase in body fat, particularly in the abdominal region. Testosterone helps regulate fat distribution in the body, and a decrease in testosterone levels can lead to an increase in body fat, particularly in the visceral fat around the abdomen. Visceral fat is associated with an increased risk of several health problems, including cardiovascular disease, insulin resistance, and type 2 diabetes. Additionally, an increase in body fat can further contribute to low testosterone levels, creating a vicious cycle. Number 6. Mood changes such as depression or irritability. Low testosterone levels can also contribute to mood changes such as depression or irritability in men. Testosterone plays a vital role in regulating mood, and a decrease in testosterone levels can lead to changes in emotional well-being. Low testosterone levels can contribute to symptoms of depression, such as low mood, lack of interest or pleasure in activities, and feelings of hopelessness. Additionally, low testosterone levels can lead to increased irritability, mood swings, and a decrease in overall well-being. Number 7. Decreased bone density. Low testosterone levels can also contribute to decreased bone density in men, increasing the risk of osteoporosis and bone fractures. Testosterone plays a crucial role in bone growth and maintenance in men, and a decrease in testosterone levels can lead to a decrease in bone density. Testosterone helps stimulate the production of bone cells and regulates bone turnover, which is the process by which old bone tissue is removed and replaced by new bone tissue. A decrease in testosterone levels can lead to an imbalance in bone turnover, with more bone tissue being removed than replaced, resulting in decreased bone density and an increased risk of bone fractures. Number 8. Decreased body hair. Low testosterone levels can also contribute to a decrease in body hair growth in men. Testosterone plays a critical role in the development and growth of male secondary sexual characteristics, including body hair growth. Testosterone stimulates the hair follicles to produce new hair growth and regulates the thickness and texture of the hair. A decrease in testosterone levels can lead to a decrease in body hair growth, particularly in areas such as the chest, face, and pubic area. The treatment for low testosterone depends on the underlying cause and severity of the condition. Here are some common treatment options. Number 1. Testosterone replacement therapy, TRT. Testosterone replacement therapy, TRT, is a treatment that involves supplementing the body's testosterone levels through various methods, including injections, patches, gels, or pellets. TRT is typically recommended for men with low testosterone levels, also known as hypogonadism, who are experiencing symptoms such as decreased libido, erectile dysfunction, fatigue, decreased muscle mass, and increased body fat. TRT works by increasing the amount of testosterone in the body to levels that are considered normal for men. Depending on the method of administration, testosterone can be delivered to the body in various ways. For example, injections involve injecting testosterone into the muscle tissue, while patches, gels, and pellets deliver testosterone through the skin or subcutaneous tissue. The goal of TRT is to alleviate symptoms of low testosterone and improve overall quality of life. However, TRT is not without potential risks and side effects, including an increased risk of blood clots, prostate cancer, and sleep apnea. Additionally, TRT may not be suitable for all men, such as those with a history of breast or prostate cancer. TRT should only be initiated after a thorough evaluation and consultation with a healthcare provider. Before initiating TRT, a healthcare provider will typically perform a blood test to check testosterone levels and evaluate other potential underlying causes of symptoms. Treatment with TRT should also be closely monitored to ensure that testosterone levels remain within a safe and effective range. Number 2. Lifestyle changes. In addition to medical treatments such as testosterone replacement therapy, TRT, certain lifestyle changes may also help boost testosterone levels in men. These changes can be particularly beneficial for men with borderline low testosterone levels or those who prefer to explore natural approaches before initiating medical treatment. Losing weight, excess weight, particularly around the waistline, has been linked to lower testosterone levels in men. Losing weight through a healthy diet and regular exercise may help increase testosterone levels. Exercising regularly, regular exercise, particularly weight-bearing and high-intensity exercise, has been shown to help increase testosterone levels in men. Exercise also helps with weight loss and improves overall health and well-being. Reducing stress, chronic stress can lead to increased levels of cortisol, a hormone that can lower testosterone levels. Engaging in stress-reducing activities, such as meditation, yoga, or deep breathing exercises, may help lower cortisol levels and increase testosterone levels. Getting enough sleep, poor sleep quality or insufficient sleep has been linked to lower testosterone levels in men. Aim for 7 to 8 hours of quality sleep per night to support optimal testosterone levels. Consuming a healthy diet, a healthy, balanced diet that includes adequate amounts of protein, healthy fats, and micronutrients such as zinc and vitamin D may help support optimal testosterone levels. While lifestyle changes may not be enough to fully correct low testosterone levels in men, they can help improve overall health and well-being and may be particularly beneficial in combination with medical treatments such as TRT. Number 3. Medications. In addition to testosterone replacement therapy, TRT, and lifestyle changes, certain medications may also be used to help increase testosterone production in men with low testosterone levels. One medication that is commonly used for this purpose is clomiphene citrate, also known as Clomid. Originally developed as a fertility treatment for women, clomiphene has been found to be effective in increasing testosterone production in men. Clomiphene works by blocking estrogen receptors in the brain, which can lead to an increase in luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones stimulate the testes to produce more testosterone. Another medication that may be used to increase testosterone production is human chorionic gonadotropin, HCG. This medication mimics the effects of LH and stimulates the testes to produce more testosterone. In some cases, medications such as aromatase inhibitors or 5-alpha reductase inhibitors may also be used to help increase testosterone levels by blocking the conversion of testosterone into estrogen or dihydrotestosterone, DHT, respectively. It's important to note that medication-based approaches to increasing testosterone levels should only be used under the guidance of a healthcare provider. These medications can have potential side effects and should be carefully monitored to ensure safety and effectiveness. Number 4. Surgery. In rare cases where hypogonadism is caused by a problem with the testicles, surgery may be required to correct the underlying issue and restore testosterone production. One such condition that may require surgery is testicular torsion, which occurs when the testicle twists and cuts off its own blood supply. This can cause severe pain and, if left untreated, can lead to permanent damage to the testicle and a decrease in testosterone production. In some cases, surgery may also be required to remove a tumor or other abnormal growth on the testicle that is affecting testosterone production. In addition to surgical interventions targeted specifically at the testicles, other types of surgery may also have an impact on testosterone levels. For example, surgery to remove the prostate gland, prostatectomy, or the testicles themselves, orchiectomy, can lead to a decrease in testosterone production. In all, low testosterone can have a variety of symptoms, ranging from decreased sex drive and erectile dysfunction to mood changes and decreased bone density. Fortunately, there are a variety of treatment options available, including testosterone replacement therapy, lifestyle changes, medications, and surgery. It's important to work closely with a healthcare provider to determine the most appropriate course of treatment based on individual needs and health status. By addressing low testosterone levels, individuals can improve their quality of life and reduce the risk of associated health complications.